Today I'm here in front of you just to talk about screening. It's something that we consider very important for all women and men. So we'll just start by just a slight definition. What is screening? Especially towards breast cancer and cervical cancer. Screening mainly means when you are checking for the presence of any disease before there is onset of symptoms. You find for breast cancer or cervical cancer, we always advise women and men, especially for breast cancer, to go for screening. So when you check for symptoms before the onset of symptoms, that's what we mean. It's very important that you go for screening because it helps in saving lives, because it has been shown that most times, if you routinely go for screening, the risk of you developing a full-blown disease, either breast CA or cancer of the cervix, is very low. Because we are able to detect some changes on either the breast or the cervix before the onset of disease. And it also helps quite a lot in just saving life. Because if we detect early, we are able to treat you on time and we save your lives. So you find that who are the people do we encourage on undergoing, especially cervical cancer screening? We find that any person who has a uterus or cervix, we always advise them on going for screening. And within that process, we are able to detect the abnormal cells very early so that we can institute the appropriate care. You find the duration between us detecting the abnormal cells to development of full-blown cancer of the cervix, it takes between almost 5 to 20 years. So we find when we detect the abnormal cells, we have a good duration to treat you appropriately before the onset of the full-blown disease. For cancer of the cervix, we have a number of modalities that we use for screening. You find mostly we have what we call pap smear. Most of you are aware of it, but it's always good to go through it again so that you understand better. We have also what we call HPV testing. And sometimes you find when you go for screening, we may combine both. Either we may decide we do a pap smear if we detect is abnormal, and then we do what we call the HPV testing. For screening of the cancer of the cervix, we always advise anybody who gets to the age of 21 and above, it's good that you start going for screening for cancer of the cervix. So we'll just put a category of ages and when should you be going for screening. Between the age of 21 to 29, we advise that it's good you have a pap smear every 3 years. And between the age of 30 to 65, we advise that you go for either pap smear or HPV testing. Pap smear will be every 3 years. HPV testing gives you a longer duration, so you find you'll just be going for every 5 years. And for patients who are above the age of 65, we still advise them to go for testing mainly for HPV testing. You find if you are above 65 and you have been consistently doing screening earlier, you find if they have all been normal, we'll tell you there is no need to continue. But if you are 65 and you haven't been going for screening in the past, you find we will tell you it's good, we keep screening you. There are other situations whereby we may need to screen you within a shorter duration compared to the other ones that I have spoken about. And these are the cases whereby any person who has either a HIV infection or if you have a weak immune system whereby you underwent either a transplant and you're on medication to help your kidney not to fail. If you have either some of the diseases, there are some people who their own body reacts to itself. We call it autoimmune disease. So sometimes we give them drugs to lower their immune system. So if you have that, you find we advise that we shorten your duration of screening and we will tailor-make it probably every year. We need to screen you. And also, we'll shorten the duration if we do a pap smear or HPV test and we find is abnormal. So we will also shorten the duration for that. And also after that, there are patients who have been treated for cancer of the cervix. So if we found precancer changes and then maybe we treated you, we'll also advise that your screening should be shorter and like the duration for the other people who their pap smear or the HPV was normal. In terms of where do you get the screening and what should you expect when you go for screening for cancer of the cervix? It takes a very few minutes, maybe around 5 minutes for you just to go for screening. For you to be comfortable, we'll always advise you to empty your bladder, to lie on your back, to bend the knees, and then we use a very small brush to take a sample. It's just slightly uncomfortable but not painful. And we always advise for the men, it's always good when your wife is going for either of these stages, it's good you accompany her, whom we call a chaperone. Screening can be done in either in hospital, either in a clinic or within a doctor's office. There are things which say, I know majority of the people always feel that they should go for screening only when there are symptoms. We say the opposite. Go for screening when you are fine. Don't wait for symptoms to develop so that you start going for screening. Because remember, screening, we are trying to detect the abnormal cells before symptoms occur. So by the time you start having some symptoms, either discharge from the private part, either you are losing control of your bladder, you are having either pain when you meet your partner, or you find your menses are heavy, don't wait for that before you go for screening. Although we say when you see that, don't give it more time that you are waiting, all will go well. No, we advise you need to see your doctor if you see any of those symptoms. So mainly that's on the breast here, or breast cancer. We'll move to the next topic of breast cancer after the cervical cancer. Breast cancer mainly is the same thing. When do we advise that you go for screening? When you go for screening for breast cancer, either for breast we say men or women, because breast cancer can also develop in men. It's rare, but it's there. So we advise that it's always good also men, you just check yourself. What are the criteria do we use in terms of just screening for breast cancer? We advise that any woman or man is good that you always examine yourself. You can put either every day or one day of the week. You can consider you always examine yourself. We always advise that so that in case of any early changes, you are able to see your doctor as early as possible. So practice self-breast exam. When you see any of your doctors, just ask him, how do I do self-breast exam? And also is something you can find even on YouTube. So for breast cancer screening, we advise that the same, if you get to the age of 21 and above, it's always good that you start self-breast examining. And also, if you find any mass, other methods of screening are things like we do a breast ultrasound. So that one will be done at the doctor's office. The other people, if you are above the age of 40 years, we do what is called a mammogram. And we find we'll advise that we repeat a mammogram every 2 years. So what do you expect when you go for a breast cancer screening? I always advise the patient that it's good to have a half dress or a half skirt or a top, because we'll need you to expose the upper body. So it's always good, come with a skirt for purposes of just comfort. Have a skirt and have a shirt on, so that in terms of examination, or if you need a mammogram, it will be easier for you and you'll be comfortable. So once you do that, you'll find we'll need you to expose the chest, to remove the bra, so that we're able to examine the breast completely. And we'll need to put your hands on the side. There's a diagram I just showed on what do you expect when you're going for screening, mainly that, when you're going for the ultrasound or you're going for the mammogram. So that's all I had for today. The screening can be done any doctor's office. We are available at Better Living Hospital, that's just across the road next to Integrity Center. Any day you can come for screening. Thank you very much.